Hey guys, welcome back to my channel. Today I am a little more than 4 months post-op. 4 months post-op would have been April 3rd. So I'm just a little more than 4 months post-op. Today's video is a scar update and overall how I'm feeling, how I'm doing, if there's any new symptoms, not. But yeah, just remember I did go to DR to get my surgery done. I had a tummy tuck muscle repair. Lipo to the hip, flanks, and back, and my underarms. My doctor was Dr. Toribio. I stayed at Villa Vida too. So that's just a little information. Yeah, so I don't have any new complaints. I don't have any new concerns. I do have an update on my scar and my splitting stitches. I'm going to show you below. I did just get out of work. I was working about 9 hours today, so I stayed in my faja and my waist trainer. I know I was supposed to get out of it or like be out of it most of the time when I was 3 months post-op, but my massage therapist told me that I'm not ready to get out of it completely. So I do wear it during the day, 7 days a week, and at night I just take it off and then just, put it back on. So let's go with the results. So I told you guys in a previous video, I didn't know that I had my like under my breast lipoed. Like I didn't know that. Maybe I should have known because clearly the marks are here. Where's the other mark at? Right there. So I should have known it, but I didn't. But I did ask the doctor because I had this bump right here that, like, when I told you when I was like just pushing in and out, it was hurting. So I was kind of getting a little nervous, but then I thought like it couldn't be surgery related. But yeah, so it was fibrosis, so nothing to worry about. This is how I look. You'll see the faja marks and the waist trainer marks. This is my belly button. I really like my belly button. Let me see if I can, right here. Like, yeah, I like my belly button. I still have a splitting stitch coming through up here that hasn't came through. But other than that, I like it. I'm still trying to lighten this scar up. So this is the side. This is the other side. That's the lipo. Oh, one thing I did want to tell you that I did notice, since I did get my lower back contoured, I did have like a mark on like my crack. It looks like a dimple, but I noticed it like a couple of days and I was like, wait, what? I didn't even know that. But yeah, so usually people have two marks from lipo. So I have three. I have two on my back and then one on my crack, which is fine. Like you can't see the crack as much. I'm gonna try to show you guys if I can get a good angle, but that's just something new. So this is my results. And I was using the rose hip oil, which was lightening my scar a lot. At least like I noticed it. But then I ran out and I didn't even notice I was running low. So I just placed the order for another one, but I see that it's getting back darker. So kind of bums, but it's okay. I do have a splitting stitch somewhere. Oh, right here. So I do have a splitting stitch right there. It's coming through. And it looks like a blackhead. It doesn't bother me or anything like that, but it does bother like when I'm trying to lay down. If it's like on my sides, like there's one around here. So there's one coming through right here. And that bothers, like when I try to lay down, it like burns. So I have to just like still lay on my side, but just kind of ignore it because it's not gonna like stop me from anything. So you see this scar, a splitting stitch came out of there and it left a little mark. So all those like dark like little areas, this one, that's the splitting stitch. That's when it came out. And then I remember I told you guys like right here have like this little fatty part or whatever. I say it's a puppy dog ear or whatever they say it, but a lot of people are saying it's not because it doesn't hang. So I don't know, but I have that extra fat. It is swollen a little, so it's a little it's protruding out a little more than usual, but that's what it is. Um, so this, I told you he contoured my back. That's the lipo. And then I have another mark here. Oh, you can see it right here. That's where he contoured my lower back. So it looks like I got my butt done, but I really didn't. Oh, it's a glare. I really didn't get my butt done. I didn't get nothing done to my butt, but I really appreciate the way he contoured my back and made it seem like I had one done. I mean, it looks good. I mean, I'm happy with it. Like, I like the way he did it. So that's the other side. So, yep. And then he did under here, like I told you guys, which was awesome because it just makes for a better appearance and makes for a better result. So this is far away. And that's it. And that's all I have for you guys. So yeah, so I'm happy with my results. I wouldn't change anything. It is a lot. It is a long journey. Recovery is long. You do have to be patient. Everyone asks me all the time, are you happy you did it? Yes, I'm very happy I did it. Would I do it again? I probably wouldn't do it again just because mentally it's draining. And I know I said it a few times and I'll always say it, like, mentally it took a lot out of me, and it took me 3 months to actually kind of feel like normal, like without having like these breakdowns, without crying, and without being so emotional. So yeah, so I probably wouldn't do it again. That little fatty part that I showed you guys, that I say to puppy dog thing, I know it's like a 15-minute procedure and all he has to do is lipo it, but I don't think I really care enough to like go back, or I want to go back, just because I just don't even want to relive the whole thing. But that's not saying that my doctor wasn't great, because he was great. He was patient and he reassured me. He has this aura about him. So it definitely wasn't him, it was me. But yeah, I probably wouldn't go back. Like, I've brought bathing suits, I've tried them on. This is my daughter. Say hi, Lily. So yeah, so she's been with me. That's just one of three. So yeah, so I do have bathing suits that I've brought and that I've tried on that I'm okay with. Like, I showed, like, putting them on, it kind of conceals that little fatty pocket there, or whatever that thing is. So I'm okay with it. Like, I have no problem with it. The only thing I'm gonna try to do is work on the scar a little bit to try to lighten it up. If I can, that's great. If I can't, then that's fine. But I do want to try to lighten up my belly button. Like, you can't see it now, but it does have a scar, and I feel like when I look in a mirror, it looks funny, but I feel like in person it doesn't. But I love the shape of it because it's so natural looking. Like, it looks natural. It doesn't look like, a messed up belly button. It looks like my belly button before I had surgery. So that's good. So this is just my results. You'll see my daughter. She's with me. She's been my support. She probably thinks I'm a little nutty, but you think I'm a little crazy? Let's see if she thinks I'm a little crazy. Do you think I'm a little crazy?
Well, when you start to panic over, you started to panic over something that wasn't even. You started to panic because you thought that it looked different. Like your stitches were coming up or they were loosening, and you kept on asking me and Dad, "Are they loosening? Are they this? Are they that?" I'm starting to panic. So that part you were a little crazy.
See, so that's why I wouldn't do this again, and that's the only reason why. It's just the mental stress of not knowing. Um, but I mean, I'm always down to go with my friends because I know a lot of them want to do it. So I feel like I can help them a lot. I feel like if I ever in life was to go again, there's a lot of things that I would do differently. and I'm better mentally prepared. But I don't think I'm doing that because I'm good the way I am. I do wish I would have listened to the doctor and filled in my hips and just shaped my butt a little bit, but not really my butt, but my hips. Because if you notice my hips, like my hips just go straight down. There's like no curve. Like even this side, there's like, oh wait, I don't want to flash you guys, but like there's no curve. Like there's no curve. But I mean, I came to the yard to get rid of my stomach, get rid of the fupa, and that's exactly what I did. But if I, were to do it again, I would fill in my hips a little bit, but definitely leave my butt alone. But that's about it, guys. That's all I have for you. If you guys have any questions, comments, anything I can use for my scar to lighten up, I'm using the rosehip oil. And it's not really oil, it's a serum. And it only comes, it's like this big. So it's little and it runs out quick. And I'm using bio oil. So anything you guys know that can lighten up the scar, I'm always down to try. But until next time, see you later. Bye, guys.
Bye.